We welcome each one of you to the panel discussion in the special interest group, Holistic Human Health. The panel discussion will be for 90 minutes. That includes the recall of key points from the keynote session today. There will be two rounds of moderated discussions for 50 minutes, followed by a moderated interactive question and answer session for 10 minutes, and conclusion of the panel discussion. Each panelist will be given 2 to 3 minutes to share their point during the moderated discussion. There will be a timer that will be displayed for us, for our reference. So first, we would like to introduce all our panelists for the session. We have Dr. B. Satyanarayanan. He is currently working as the Associate Dean Student Affairs and Professor of Pharmacology in SRM Medical College Hospital and Research Center of SRM IST. He is also serving as a chairperson of the UHV
Committee. 2-3 lines at most.
Yeah, okay. And he has 29 years of teaching experience. He is a core member of the Medical Education Department of the institution, and his area of research interest is neuropsychopharmacology. We have Professor Deepesh A. Professor Deepesh A is a regional coordinator, Southwestern region of NCCIP. He has experience both in the IT industry and in the academia. He is connected with the Universal Human Values from 2022. We also have Professor Swapan Channana. He's been teaching in the Department of Business Management of PCTE, Group of Institutions, Ludhiana, for the last 25 years. He is also handling the responsibility of Director Student Welfare. He's been teaching the subject Universal Human Values to the courses like MBA, BTech, BC. We have amongst us Professor Aprajita Singh, Assistant Professor, TIMSC, DR Mumbai. She has served as the HOD and Deputy Director in the same institute. She is teaching in the Department of MCA and is exploring UHV since 2020. We have Dr. Mirunalini G, Anesthesiology, MD. She is a certified pain management physician and working as an associate professor of anesthesiology in SRM Medical College Hospital and Research Center of SRM IST, Tamil Nadu. She has authored 2 books and she is a life member of Indian Society of Anesthesiology. Now I would like to introduce Dr. Sharmila Asthana. She has worked as an assistant professor of pediatrics at St. Christopher's Hospital for Children in Philadelphia, PA, USA, for a few years, after which she moved back to India. She was a senior consultant pediatrician with Apollo Hospitals, practicing comprehensive pediatric medicine for about 2 decades, and also worked with Lucid Diagnostics for a few years. To work towards a wholesome and integrated approach to health, she left.
Enough. Let's go forward.
Okay. So I welcome Dr. Sharmila Asthana to kindly share today's key points from the keynote session. Over to you, Dr. Sharmila Asthana.
Thank you very much, Dr. Soumya. And I welcome all the dignitaries of the panel. So just to briefly recap what we have talked of so far, on day 1, we were talking about the need for holistic health. We discussed some of the concerns that we are largely focusing on the physical health, looking at the human being as a body. And even in physical health, we are not really talking about health, but we're talking of getting rid of disease. Then if we look at getting rid of disease also, are we really solving the problem or are we ending up suppressing the symptom? We also had concerns regarding, values lacking, searching for happiness outside, and with that, as a secondary thing, profit maximization, and so on. So on the second day, we spoke of the vision for a holistic, solution-centric approach to the current scenario. And in that, we spoke of having a holistic approach in that we approach health through looking at mental health or health of the self, physical health or health of the body, and also the health of the environment. Because as a human being, we are a part of a family, we are a part of society, We are embedded in this nature, this existence. So all of this, if we can consider, because the human being is not isolated from these, and giving number one priority to mental health, so that when we take care of mental health or health of the self, then physical and environmental health will follow. And we also spoke about the program for physical health, where we could consider having health in the forefront rather than disease, and having courses in the curriculum where we talk of how to stay healthy, taking care of the intake, the lifestyle, exercise, postures, breath regulation, and all of that, including what we are already doing, talking of disease, the disease management, treatment, and so on. Next slide, please. So if we look at implementing this vision, some of this we have heard already in the keynote earlier. So the proposal is that we talk of a healthy self, and for that, we bring about independent courses of human values, courses of holistic health in medical education, and ultimately work towards a holistic, value-based system of health education. When we talk of healthy body, this program of health that we spoke of, where the healthy self can take care of the healthy body, bringing about awareness about that. And when it comes to the healthy environment, health in every family, so harmony in the self and harmony in the body, both to be a consideration. In the society, we could have centralized systems where health education can shift towards a holistic perspective in our medical or MBBS and nursing programs. We could also have more research on the self, outcome or evidence-based research having to do with the self, and perhaps health maintenance centers or holistic wellness centers where we could have integrated streams of medicine, connecting. When it comes to nature, looking at our role of complementarity to nature and holistic treatment modalities. So, for example, we could look at, pre and probiotic use more in addition to what we are already using as antibiotics. So I would like to hand the mic back to Dr. Soumya for the panel discussion.
Thank you, Dr. Shamila. Now, let us start our moderated panel discussion for 50 minutes.
You can go skip this, go to the next.
Let us start discussion. I would like to, put in front of each one of you this question. As a healthcare professional, what do you see as the possibility of implementing this holistic vision of health in your institution, area of influence in the following? To start with, awareness regarding values in the health through workshops, health courses as add-on, value-based education with focus on health rather than disease. Example, phase one, like UHV 1 and 2 workshops in their institutions. Phase two, holistic health, human health workshops in the institution. And phase three, holistic health courses in the institution in MBBS, nursing, pharma, etc. I would like to open the discussion for your comments. Let me invite Dr. Deepesh.
All right. So let me put my points in the implementation part regarding this. So I was a little bit skeptical when I joined the day one of this conference. And then slowly I started understanding the need. And then I started introspecting the vision also yesterday. So right now, what I'm thinking is like we need to implement this more or less in our institution. And one part I think is where we can think of, at least I think that uh, I'll take up this workshops, which is actually the first part, the preliminary part, as the understanding part to my organization. So again, this is not so, it's a new concept in my organization, even for the policymakers and all. We have a team there. So I'll have to interact with my team over there. Then I will request them also to explore on this. And probably what I think is that maybe in 2-3 weeks, we will try to plan an introductory workshop in our institutions with the policymakers, and maybe suggest a leadership development program also. And then from taking the initiatives from all the stakeholders in our institution, what I'm thinking is that maybe in another 3 months, we will have the understanding part, which is actually the implementation of the workshops in our institution. So that is one thing which I am right now having in my mind. And then probably then taking the advices from there also. And I do have to do some investigations on this. This is a new concept for me also. So based on that, we will think on implementing this as part of our curriculum in our institution. So then again, there is a lot of work to be done. There might be some practical difficulties also there to be seen. And I'm thinking that maybe in another year or so, we may be possible to implement this as part of the curriculum also. So, and then we will start practicing it along with that. So this is how I think, Dr. Soumya, which I'm thinking as part of my implementation.
Thank you, Dr.
Over to you.
Dipesh. Now I'd like to take the opinion from Dr. Shrija Madhu. Dr. Shrija Madhu. Let us hear, while Madam is connecting, let us hear from Dr. Vasanthi. I hope I'm audible.
Yes, Didi, you're audible.
Yeah, you're audible. Maybe you can ask some of the others.
Let me take the opinion from Dr. Mirunalini.
Yes, so I am also hearing into this conferences and about this holistic approach to health for the past 2 days. So even though I feel there is some promising aspect for this healthcare system in this, see, I feel there are many challenges that I might face in my institution. First of all, in medical institution, the curriculum is already packed with hours and hours of medical curriculum. So there will be practical difficulty in incorporating this holistic health and UHV into that. And regarding the workshops cannot be organized by a single person. It needs a team. So first of all, I find it very difficult to gather a team together, convince them, to how these what is about this universal human values, and how this is going to help the institution and the individual, whether it will be useful for them particularly. And then only after convincing I can put up a team, and then with that team only I can start organizing the workshops. And next, coming to the institution level only, how am I going to get funding for all these workshops? The institute has to support when they have no idea about all these things. And when this institution goal does not align with this universal human values. So I might find it difficult to get funding for organizing these workshops in my institutions. And obviously, once all this is done, then even then there might be lack of number of trained faculties for imparting such courses to such a big institution, thousands of students. So I find all these things as real practical difficulties. So maybe I'm looking forward to some ideas from anyone here, like how it can be implemented.
What about your individual commitment, doctor?
So like I said, my individual commitment, I personally feel there is some scope here, but as an individual, I don't think I can establish much without the support from my institution and from my group. So yes.
Thank you. Now, let me invite Dr. Shrija Majudi.
Yes, I too feel after listening for the 2 days of this workshop, I too feel this is a real need there is, and after knowing the vision, but I am really interested in knowing how we can go with the implementation and whether it is a feasible thing we'll be able to implement or not. I would like to know about all these things. And uh, as it is mentioned, like we can go with the UHV workshops initially, and how we'll be able to conduct these workshops in our institutions, and in a holistic way, whether these things we can take it forward. I would like really look forward to this and would be interested in seeing that this is really implemented and we are able to do some improvements in our health sector rather than only concentrating on curing the real kind of treatment by taking mental health into consideration, self into consideration. If this is going to help the patients and the health sector as a whole, so I would really look forward for the implementation of this holistic approach in our health sector. Thank you.
Thank you. Now, I would like to invite Professor Swapan Channana ji. Also, I would like you to, share if you faced any challenges when you were to start this in your institution, and if so, could you throw some light on how you overcame some of these challenges, and what steps were taken at your institution to set up these processes in your institution? Over to you.
Thank you,
Professor.
Didi. Yes, you're right. Implementation is a challenge, but then I think we are fortunate that in my institute, we are affiliated to Punjab Technical University. So in that already this course has been introduced and it is being taught in our all first years and even second years, various courses. And now even because if one person take it very seriously, I think that can make the difference, because if you are doing the verification as a teacher, and then when you stand in the class with that confidence, and then obviously it's a slow process. So when in my institute, when I took it very seriously last 3 years, especially after the morning sessions, and I saw the participation, and I find that this is the only solution, because I first of all did experimentation on myself that I have already shared. So I thought that now it has to be taken to the students and the teachers. But first of all, I think the teachers are very important, because if the teacher is not standing with the confidence and he is not convinced, how will it go to the students? So already I have got a team of 20 teachers this time, and fortunately they are from the pharmacy department. So they are already going through the online. I have made them to go through online workshops, and now I'm planning in December offline workshop. And even now the new education policy and all this NAC, it is also helping, because they are also talking about all this mind, values, holistic development. So now I think even the institutes are understanding under the compulsion only, but then I think it's an opportunity. Like day before yesterday, we had a conference with the name of Indian Knowledge System. where our Vice Chancellor of PTU, Dr. Sushil Mittal came and all. The atmosphere is being created. Like even then, I talked to even the pharmacy teacher. They also said that, okay, there are issues of the mental health and all. And they are holding a lot of workshops on health as we have discussed last 2 days. But more focus is on the body and then the disease, although they are also talking about the lifestyle intake and all that. But I think till the holistic concept, this process of self-exploration, that body is separate and it's an instrument of mind, and who am I? So I think self at the center stage, as as Dr. Sharmila even talked today also. Uh, I think self is at the center stage. So the best, I think the first thing is this, that first of all, one person, even if he is convinced and he is doing some experiments, and then it can spread to the other teachers, and then from teachers to the students, and then I think it will be going to the families, and then I think it will go to the societies. So already the workshops are being planned on UHV, but then the next step will be the workshops on holistic health. And then I think even add-on courses is again, I think today the atmosphere is there because new education policy is saying that add-on courses has to be there. So this is what I think. Atmosphere is already there, need is already there. People are understanding it. Only few people, even if they take it seriously, I think it can be implemented, and it is being. I find this a huge opportunity in my institute to do this. Thank you.
Professor, can you throw some light on what is taken up in your institution, and how long has it been since you've connected to your UHV at your institution?
Didi, it had been there in my institute for many years, but then again, you also know that it is being taught, but then people are not implementing it. It's just being taught as any other course, and sometimes it's not even taken that seriously. But then when I started this journey, and then because I got benefited, I got a lot of benefits from this. My body becomes better. There was a lot of confusions, contradictions within myself. When I started working on myself and then I saw the results, even body becomes better, commitment becomes better, relationships become better, participation becomes better. Then obviously the next step is then you will give it to the others. So now I'm talking to the teachers more who are teaching this, because I cannot be in every class, because there are around 1,400 students right now, the first year students who are taking this course of UHV. So I can't be in every class. It's a team. Yesterday we talked about all these students, and then I go to every class. So I think it's not easy, because a lot of conditionings and a lot of that outside. It's now proposals are coming from outside, which people are being influenced. But I think this is a need of the hour. Last 2 days we have discussed now. Even means hospitals are means full with the psychosomatic diseases. So I think mental issues, health issues are there. So they are not being resolved. Although we are doing a lot of means practice, medicine practice and all. I think now it has to be implemented, but then it has to be implemented slowly and continuously. The patience is required. So I see huge opportunity in my organization. Thank you, Didi.
Yes, Professor, thank you very much. Now let us start the second round. Let me, ask another question to all our panelists. Your willingness for participating in and comments regarding holistic wellness clinics as an add-on to the current system in your institution, and ultimately your institution becoming a holistic center of well-being, incorporating educational workshops on UHV, holistic human health, and various streams of medicine under one roof. What are your comments and your willingness on this? Let me welcome Dr. Deepesh.
Didi, that slide is not visible. The timer is visible actually. Probably you can share that slide.
I started the timer via, that is why I think. Okay, let me stop the timer.
And put the slide.
Yeah. See the slide now.
No.
Now,
Yes. Now I can see. Let me go to that question actually. Okay, so continuing with what the commitment what we have proposed earlier. So again, this is something which need to be discussed. When I put some commitment, then it should be kind of workable, doable right now. So as I said earlier, so the practical difficulty in the implementation part is there, because this is in an institution of the kind of institution what we have, where we have the multiple departments over there. Then and also, as I said, the this is something new to our institution, which means that we have to go step by step. So starting from the education, educating our the policymakers in our institution, the academic council, and all those things, we have to go step by step. So there is a practical difficulty in committing, like something like thinking about holistic wellness clinic. But I see that these are all good things and probably doable. But when we say it in the form of commitment, there may be many hurdles to be overcome before we get to the implementation part of that. So I'm a little bit concerned about committing in the implementation part in this context right now, because as I mentioned, we have to start it by step. So let's start with education, and then we'll go by step and see how it is progressing. That's what I can see as part of commitment, Dr. Soumya, right now. Over to you.
thank you, Professor. Now let me invite Dr. Mirunalini.
Thank you. So I'm been hearing how Dr. Swapan has implemented and is implementing this. So he also said that initially there was a lot of difficulty in implementing, and still he's facing challenges. But in spite of this, he was able to do it, which is actually very nice to hear. Because on my part, individual part, I feel there is some promise in this. So what I understood from Dr. Swapan sir is that the teacher has to be committed and strong in the whole about the value of this thing. So I think first I'll start with my journey, my self exploration, and maybe I'll start working on myself. And sir said like he had got so many benefits out of this. So maybe if I start exploring and starting this process with me, and if I start to see the changes in me, then maybe if my view becomes very strong, then maybe I can take it step by step. Of course, there are so many of you who are there to help us, hold hands in taking this forward. So I feel confident maybe I can bring about this add-on courses and this holistic wellness clinics in my institutions with all the support. So first, my commitment I would say is I'll start with myself first, and then I'll form a small team who are also equally committed to this, and then from there on we'll take it up regarding this holistic center. It has to come from the management regarding the infrastructure and the timing, working timing, and all the interdepartmental collaborations. All these things have to be worked upon. So for this, I think we'll need a very strong team, and for that, I think I'll start from myself first. I have a little confidence now that it can be implemented, but the practical difficulties I'll see as and when I start doing this. Thank you.
Thank you, Professor. Now let me invite Professor Swapan Channaji.
Thank you, Didi. Sorry. Thank you. I was telling you that already there are, means even in the organization, we see that people have a lot of behavioral issues and anxieties. Like I think more even on the last 2 days, the mental health and stresses, I think we are able to see that because now we are going through this all UHV process. We can see that earlier also, even we were in that stage, but now we are a little ahead because we are getting that awareness. So I think again, it depends upon means how you conduct yourself, and then and like I told you yesterday, there was a day before yesterday there was an Indian knowledge. Only yesterday there was a day before yesterday Indian knowledge system, and they were also talking about the Ayurveda. So it's not that means people are not talking about that, because people have seen that all these whatever the developments is happening, it's not showing the results. Even like yesterday we were discussing in the vision that yes, we have developed the medicines and all that. It's very nice. Means even the machinery part, it's so well, but still the issues is not, means hospitals are full and mental health is still suffering. So I think now we have to look for some alternative solution. And I think this holistic health development, even in the keynote note that we learned, we heard that solution based means we are just doing the problem solving, crisis management is being done. But then again and again, people are going back to the hospital with the same problem. So I think it has to start with the education, first of all, with me, and then slowly and slowly, I have to means conduct the workshops. Like we can have the experts who will be talking about the holistic health, again in the form of proposals. Even to all this, I think the medicine people, like the pharmacy department, I think they are already into this, but then when they will get this perspective also, and they are already, I think, aware of this. But then when the concept of this self and body will be made, and self will come at the center stage, and for that again, I think then things will start moving. So first of all, this UHV course, I think it can be a starting point. Already it is there with the compulsion of our university. And the second, we can have this holistic health workshops where the experts can come and start talking about it. And then I think, again, the atmosphere is there for add-on courses. Already it is a national education policy saying that we have to have a lot of value-added courses. So I think we can do it, but obviously it cannot be done in one day, but I think it has, the atmosphere is already there for that. In my institution, at least, I can tell you that. Thank you.
Thank you, Professor. Now, moving, I thank all the panelists for sharing their thoughts on, the panel discussion. It was a very interactive session. Moving forward now to the Q&A session. You would like to know if there is any question that could be asked, you may kindly type it in the Q&A option. Any questions to our panelists? Okay, so we shall conclude the panel discussion.
Yeah, you can conclude.
Yeah.
You will need to put sort of just a very quick recap of what all the people said, but not like a whole summary of everything they said.
Yeah. So we had good points from Professor Deepesh that there is a possibility, and he shared his commitments regarding having some workshops at his institution. Dr. Mirunalini ji mentioned the challenges are possible, and it is challenging because it's not an individual that can take up decisions in their college, and also expressed her willingness to start from herself and then move towards this institution. We had inputs from Dr. Swapan that it is possible, and they have been implementing it in their university. It is a compulsion, but it is taking a lot of time. That's what his opinions were. So these are some of the key points from the discussion. And I thank all the panelists for being a part of this wonderful session. Thank you. Namaste to all.
Um, let me just give a few pointers. Right. Today, a lot of flaps happened, but I think despite that, we were able to go through, which was nice. Soumya, you did a fantastic job, I think. Considering it's your first time and you weren't there yesterday for the meeting. A few things that I wanted to tell you. When the panelist is putting a view forward, try to have some comment. So otherwise it becomes like you give your, they give their view and then you say thank you and you move on to the next person. But your brief comment can be there, or, something like very nice, or perhaps we can get some reflections from others about this, the other panelists or something like that. That was one thing I was thinking. The other thing is, when you conclude, did you conclude with every panelist what they had to share? You spoke about every panelist?
Yeah.
What all they shared?
Swapanji, Dipesh Bhaiya, Mirnaliji, and Srijat.
Okay, nice. Very nice. These conclusions will have to be collated, and ultimately in the plenary, we will need to put them. So they need to be little crisp. So you did a fairly good job of crisply putting it. I think those pointers, even the panelists, when they share, like Swapanji, this question came up about implementing. So if you can very crisply put, these were the challenges, this is what we did. Then the other gets confidence that, yes, this is doable. Like, for instance, for now, it would be through the UHV team, right? So you
Yes,
can
yes,
mention this,
yeah.
that there are, regional coordinators, and they have,
Okay.
there are nodal centers and so forth. And from there, we can get guidance. And you can offer that, that they can be in touch with you afterwards, and that you can give this, or you can help them connect to the people that could guide. So they also get some confidence. Like Miruji went from a totally negative view to nicely she was able to see that, okay, this is something that I can use, but how to go about implementing it. So if we can give her that confidence that, yes, there are people who can help you, then it helps for that person to commit. Similarly, when I think Miruji only, when she said, or somebody said, and Soumya, you said, but what is your commitment? So when she's already sharing that she's having difficulties, then we can't ask her for commitment. But you can certainly say that, when she's sharing all these difficulties, that perhaps, we can take, and you can, without naming, you can ask some of the panelists that, anybody here, any thoughts on this or something like that? And then Swapanji can share how they did it. And then once she has more confidence, she will commit. So, but very nicely done, I thought. We, of course, need a little more practice. The timer went haywire. So somehow we'll get Praveena ji to share her skill in this, putting the timer appropriately with a few more people, so that we are better prepared in case the people are not available. The other thing, when we have our meetings, if we can all be on time, it will help. Today we started almost 15 minutes late. Obviously, on the actual day, we can't afford to do that because things will be very tightly scheduled. But otherwise, I think it was nice. And thank you all for your effort. And hopefully we can proceed from here. Soumya, you can strengthen your moderation part. I think you'll make a fine moderator. So you can do that. Any other suggestions from anybody about anything? I may have missed several points. Miruji, anything?
See, I felt it's okay, but one thing I'm seeing here is our videos. So it's not a bright or something like that. Maybe since it is going to be telecast live on YouTube, the quality of our videos are better. I was just only thinking that, but otherwise the content it's a live sharing, so we cannot have any control over the content and all. And our moderators are there, so yes, only this was going on in my mind.
Yeah. So you mean like maybe background should be better, or we should
Yeah,
blur
yeah.
the background, or what?
Blurred background is also not working out, Didi. See, for instance, your background you have blurred, but still, since it is brown, it is looking dark only, black background. So
Okay.
something like that.
Okay. So maybe against a clear wall or
Lighter,
something.
yeah, something like that. Or we can have some virtual background if that is going to work. I'm not sure about this. I'm very new to this Zoom, but something like that.
Yeah. So we can all try to do that. Have a clear background or something like that with face visible clearly.
I
Like
think
I
yesterday
can also
Ganesh
say,
sir,
what's that?
Ganesh sir had a very nice background. If we saw his keynote, means
What
it
was
was a
the
virtual
background?
background, right? Ganesh sir.
What was the background?
Ganesh, it was again, I think, virtual background. So Didi, Ranjit
It
is
was a
right.
cosmic background.
Yes,
That
and
UHV.
then his face was very much visible and it was very nice.
Okay, I'll try to look at that and see what we can do. But yeah, we are right now, we are not focusing too much on that. But yes, that is very important, that our faces should be clearly visible, because being virtual, that is important to connect. So that is one thing. The other thing is we are too much into this G and Didi Bhaiya. Somehow it is coming in the way. So in all our meetings now, no G, no Didi, no Bhaiya. We have to stick with doctor or professor or something like that. So that, we can sort of, once we become aware of it, we will be able to get over it, I think. But it's a nice thing only, but unfortunately in this forum, it's better not to use it. It looks more professional if we just use the term doctor or professor. Yeah, nice. Any other suggestions? So video, timer, more focused points, crisper points, that we can try to work out. Once we have our roles clearly set, then we can work on only our roles, and that way it will not keep fluctuating. Then we can sort of settle those things. So very nice. Thank you, everybody. I have another session also to go to, but that's a little later. We are almost out of time. I think this particular thing took less time. The panel discussion perhaps took less time, or what took less time, because we finished very early and we started late.
We didn't have two panelists today. Prajita Didi and
Yes.
Sir Satyanarayan.
Yes. Yes.
So that
That
would
is-
have taken, like 12
that is-
minutes additional.
Yeah. So normally we have some backups also, but I think maybe I wasn't some backup, I don't know.
And even the question answer session did not happen.
Yes,
It's not
question
happening.
answer also
It's
did
not
not
happening.
happen. Vasanti ji is there or left? I guess not there.
Didi is there. Her name is there in the participants.
But she didn't respond. I think.
Yeah, I know. She didn't respond.
I'm talking. Am I
Yeah.
audible now?
Yeah. So your name was called out, but you didn't respond. So
No, Didi. By the time I unmuted, it went on to another one. Because I was writing scribe, na?
Okay. So, yeah. So, and Q&A, perhaps like yesterday you were asking questions. So I was hoping that you will ask some question. But that's okay. Maybe next time.
But Didi, I observed both the questions, similar answers they got. Maybe question has to be modified. I thought so, Didi.
Yes,
Yeah,
yes.
we'll work on those things.
Round 1 and 2, both Swapanji, Mrinalini ji, both answered the same.
No, no,
Because there
Miruji,
was
Miruji
only
had very
Miruji.
different answers. I'm sorry. Miruji had very different answers in the 2 rounds.
No, the repetition of the points, 50%. Because scope was less. That's what my observation.
See,
I
she,
think she is right, Didi.
I mean, earlier in the first round, I remember Miruji was talking about the funding, about convincing the people, how she will gather the team. And in the
Yes.
second round, she was talking about exploring for herself first.
No,
Teachers
she
need to be
said that in
strong.
the beginning also. No, repetition I said, Didi, because 60%
Anyway, we have the recording. We can listen to the recording and check it out. But what we should all listen to the recording so that we can, highlight especially our roles and see where we can improve. So I'll try to get all the recordings and put them on our group. Let's go through them. Let's see where we can improve and go from there. Yeah.
Maybe one more doubt. During this question and answer session, are panelists also allowed to ask questions of that, or is it only for the delegates?
Who allowed to?
Panelists.
Panelists, actually, I suppose we could, if there are no delegates asking. It's meant to be for the delegates, but see, in our panel discussion, when Soumya ji is talking to some, like in the first round, she can, or the moderator can ask the question to specific panelists. In the second round, she can open it to, say if somebody asks, so a panelist can also ask, certainly, in that itself. And then after the panel discussion is over, it's not just that we have to ask our specific questions, but if somebody has some concern regarding something, certainly the panelist can ask. And then one of the other moderator can just say, which panelist would like to respond to this. And so that way the UHV panelist can respond to if it is a question regarding implementing or something like that. Is that what you were asking?
Yes, because during like when I was speaking, I forgot to ask or emphasize more on how he was able to convince his co-faculties. So maybe when I was speaking, when my turn was there, I should have asked him directly, like if I could get more clarity on how this convincing of co-faculties was done from Dr. Swapan. Can I ask like that?
Yes, certainly.
Yes,
And if you missed it that time, when when Soumya ji is sort of, somebody has just finished speaking, and before she sort of asks the next question, you can just maybe raise your hand or even say, could I please just, I have a question. And then I'm sure she will not deny it, and then you can ask your question.
And Didi, this will make the discussion more lively. Means
Exactly.
even the panelists
become
will
more
be
natural.
panelists will be
Yeah.
connected with each other. Otherwise, they are in isolation, I think.
Yes, certainly. Yeah. I mean, it needs to become more natural. So that will happen once we are used to doing this more. So from now, we'll hopefully use this forum only for our meetings and see how we can improve things. Yeah. So very nice. Thank you,
When are we
everybody.
meeting next? When are we meeting next? Are we meeting today again, or when are we
No,
meeting next?
today I'm going to be busy all day. There are sharings I have to review and things like that.
Even we are asked to share. So I am also sharing between 2 to 3:30 in
Yeah.
room 1.
That's fine.
So
We can meet again on our usual days, Tuesdays and Fridays.
right.
Yeah. 7 to 8 we are meeting, Tuesdays and Fridays. We'll do that. I'll share something in the group. I also shared one video regarding consciousness. It's a little long, I think, but if you all can take a look and get some points from there. There are several videos on near-death experiences where people are clearly talking about, brain death has happened and they are able to hear the doctor, they are able to see things, they are able to, give a whole review of what happened and all of that. So if the brain is dead, then how is it possible? If you say that consciousness is a byproduct of the brain, that doesn't work. So like that, some things are there, which we can take a look at for our own clarity also. And in case if such questions come up, then we'll have something based on something scientific, especially this particular one. He's a researcher, he's a doctor, he's been working on this research for many years. And then he has come up with some of these conclusions. So that becomes something scientific that people may be able to relate to better. So, and if any of you come across any such scientific videos which are sharing these kind of things, then let me know. We can add to the group of things that we have. Okay, good. Nice. Thank you. Enjoy the rest of the day, everyone.
Thank you, Devi. Thank you all.
Thank you all. We'll
Thank
meet
you.
again on Tuesday.
Thank you all.
And we'll communicate on the group. Nicely done. Good teamwork.
Didi, maybe you can mention our roles for the next
Yes.
meeting, so that we can prepare
Yes.
for that particular role.
Yeah, I'll tentatively put it in the group today. And if it works for all of us, well and good. If it doesn't, then we'll make some changes.
Didi.
Okay.
Thank you all. Namaste.
Thank you. Namaste.
Namaste to all.
Stay.
Namaste. I'll end
Thank
the
you.
meeting.